We've always, as human beings, I guess, been conscious, maybe even obsessed with how we look, and it plays out in fashion, it plays out in hairstyle as all of that comes and goes, but it's maybe playing out in a more disturbing fashion now as we learn from the Globe and Mail, teens undergoing cosmetic surgery in record numbers, not necessarily because they need it for some medical reason or because of an accident or whatever, but because they just want to look better in their view. And to talk to me about this, and to you, Dr. Martin Eugenberg, plastic reconstructive surgeon here in Toronto, welcome.
Thank you very much. Thanks for having me.
Is this just the course of events, or are you disturbed at all by any of this? Teenagers deciding I want to look different?
Well, I think the concept of it, the way it sounds, is maybe a little disturbing, but I think the point here is that we all agree teenagers don't necessarily need cosmetic surgery. However, what's the trend that's becoming available now, the data we have from North American studies, is that there is an increase, and there's an increase in cosmetic surgery and overall in general. But teens represent about 5% of cosmetic surgery in the States, where we have the data from. I think it's safe to say numbers are somewhat similar, proportional in Canada, but we don't really know what's going on in Canada. But the thing I'd like to make clear is that it's not necessarily cosmetic surgery for vanity purposes. I think in teens, in children, there's a lot of plastic surgery going on for reasons that are pretty valid. I think we all agree that to have breast enlargement just because someone wants to have larger breasts in a teenager is not necessarily a good idea.
Well, I think, if we're talking about someone who's hardly had breasts for very long, that's a bad idea.
Yeah.
It's a bad idea. Although the Globe and Mail article that brought this to our attention mentions a young lady, it's the opposite. She needed breast reduction partly because of pain, but she also was getting tired of undue attention from boys.
Exactly.
So maybe that makes sense.
Exactly. I think the perception in public is that the plastic surgery is all about cosmetic surgery. Cosmetic surgery is only a subspecialty of plastic surgery. So, for example, the girl that was mentioned in the article was a girl who had excessively large breasts. She was having back pain, neck pain. She was getting attention from peers, older men, and this was something that was unwanted. And the treatment for that was to have breast reduction. She feels 100% better now. She doesn't get the unwanted attention she had before. She doesn't need to wear special bras to support the extra large breasts. Her life has improved tremendously.
Yeah, not everybody can use it for a career enhancement like Dolly Parton does.
No.
Well, she chooses to just embrace it, I guess. That's her decision. But there's something that the Globe and Mail calls the Heidi Montag effect, and she's a person who's gained the attention of a lot of teenagers in North America because she's undergone, and she's very young, a number of cosmetic surgeries because she just wants to fashion herself into something.
Absolutely. I think she's an example of what maybe is not so good and should not be an example as a role model for teenagers. The problem is that we have all these shows on TV like The Hills, reality shows that are not really reality shows, that create an image that is not the true image that people should look up to. But at the same time, I think a lot of teenagers look at this, and even though they get influenced by this, it doesn't necessarily translate into that much of an increase in teenagers looking for cosmetic surgery, because you still have certain breaks, the parents and their peers that do act as a bit of a buffer.
Well, and I'm talking to Dr. Martin Eugenberg, plastic reconstructive surgeon in Toronto. Well, in a lot of cases, you're right, the break would be the parent. I mean, if my daughter came to me, she's only 11 now, but if she gets a little older and says, well, I need, I'd say, what? And then I'd say, I don't think so. Well, that'd be the end of that because she hasn't got any money.
Absolutely. Well, when I see teenagers, pretty much every single time I see them, they come in with their parents.
Right.
And I make sure that through the consultation, we take the extra time to make sure that there's a real problem that's undergoing. This is not a vanity issue, that they have a problem that I can correct, that they can benefit from this, and that they are mentally ready. I think the key here is not the age, but their maturity. Are they able to understand what the problem is? Are they able to understand what the surgery can do for them, and what are the long-term impacts?
Okay, and you mentioned maturity. Would you say, even if mom and dad were there, or one of them, and saying, yeah, my daughter's going to feel better if she gets her nose done or whatever, would you sometimes say, I don't think this is a good idea? I'm not going to do it.
Absolutely. And
ethically, can you turn it down?
Absolutely.
Okay.
I think the important thing is that the patient, which in this case is the teenager, makes the decision. So when I see people like this, I sit down with them, I explain to them exactly what's going on, and I look at them and I say, listen, you have a problem, but if you don't feel ready for this, come back later. Mm-hmm. I'm not going to go away. I'll be here. Take your time. There is no rush. And I think in that article there was an example of a girl I saw for breast reduction who obviously did need a breast reduction, but she wasn't ready for it. And I told her, come back in a few months, think about it, and when you do, we can talk again.
Yeah, and you said you would turn down a young person if you didn't think it was right. If a 30-year-old woman came in and said, I don't like my nose, would you just say, well, if that's what you want, I don't care?
No. I think it's important that people realize that plastic surgeons do have ethics, and just because someone's going to throw money at me to do surgery doesn't mean I'm going to do the surgery.
Okay. You said it's kind of a subspecialty. Is most plastic surgery done because of maybe the person had an accident or something like that?
Plastic surgery is a specialty that deals with creating form and function from existing body parts where there is either a defect or an injury. That's how plastic surgery was formed. So when we talk about plastic surgery, there is the reconstructive part and there is the aesthetic part. They're very similarly related. In reconstructive surgery, there is an obvious defect. In aesthetic, you're trying to improve on something that's already normal or good looking.
Okay. Do you think maybe it's unfortunate they chose to call it plastic surgery? Because plastic is a word we use for, kind of fake emotions and fake personality.
Well, the term actually comes from Greek, plastikos, meaning to mold. And that's what plastic surgery does. It molds existing tissues.
Okay. My sister had some plastic surgery when she was a kid. She was trying to go downhill on her bicycle on this famous hill in my hometown, and she didn't make it. Halfway down, she fell off the bike. It actually ground dirt into her face, almost like a tattoo.
Yes.
And then as she was growing up, people would always say, you've got a little, they'd reach out like to wipe the dirt off her face and realize it was, and I remember the doctor said, well, you got to get to a certain age before we can fix this. We don't want to start playing with your face until it's fully formed.
I think that's something that has changed over time. I think when a person...
Well, she's old now.
When a person, regardless of their age, if they have a problem which will obviously not change over time or will not improve as they get older, then I see no reason why they cannot